Okay, good afternoon, everyone. I'm Roberto Padilla, the superintendent of Newburgh Schools, and I'm here with my team, and we just want to start off by saying thank you. We're close to 500 people who are participating tonight, and we're going to do our very best to answer questions that you might have in the chat room. We're even going to allow for individuals to just raise their hand, and if you want to know how to do that, you just click participants, you find your name, and then you just hit the icon to raise your hand, so that way we can acknowledge you. You can unmute and then ask your question or make a comment. So again, just thank you for joining us. We're slated for about an hour or so. What I'm gonna do first is I'm just gonna present my screen in a second. I'm gonna go through a number of slides, and then I'll close out by opening the floor for questions. We are waiting for our medical director to join us, Dr. Thomas. For those of you who may have more technical questions, he'll be on to assist us with that. All right. So again, welcome. Please utilize the chat room to the extent possible. And if you need to ask a question out loud, there's a way to raise your hand, and then my team can acknowledge you, and that way we can hear what your question is.
Dr. Padilla, just note the chat room has been turned off until you're finished with your presentation, then it will go live.
Thank you, Dr. Sklarz. All right, Dr. Sklarz, can you see my screen?
No, I cannot.
All right, let me see what's going on here. All right, just give me 1 second. All right, thank you. I just have 1,000 tabs open, so I should be ready to go right now. Okay, now give me 1 second. This thing's acting up a little bit. Okay, there we go. All right, so tonight is another town hall that we're having with family and community members in reference to the reopening of schools on September 1st. I want to start off by just highlighting some of our guiding principles that have led us to some of the decisions that we're making. All right, so as it relates to reopening commitments, these are the 4 commitments that we have held at the forefront of our decisions. And these were the same 4 commitments that we had when we closed out the school year. So anticipating that we weren't 100% sure what kind of guidance we would be given, we knew health and safety, high quality instruction, educational equity, and focusing on progress over perfection were the things that we needed to hold front and center. As it relates to the principles for reopening schools, we know right now that every charge that we've been given has been around getting every scholar, making sure they have the opportunity to attend in-person learning. And so for families, we have heard you loud and clear. And we also thank you for your support and patience. Many of you have reached out over the last school year saying you wanted your children in 5 days a week, not 2 days a week. And for various reasons, we could not pull that off. And so we stayed in the AABB model. And so we know this year, we're not doing a hybrid model, we're doing an in-person model. We also have a guiding principle to make sure we have consistency across our entire school district. We need to be ready at any moment in the event the New York State Department of Health, the Orange County Department of Health, the governor shuts schools down as they did a year and a half ago in March. And so we are finalizing our plans to make sure that in the event schools must close, we're ready to go and teaching and learning will not be hindered. And then we also know there's constraints. And so while this is not the ideal way to open schools, we have to overcome the many constraints that are presented to us, understanding that this is no one's fault. So current environment, as many of you probably know at this point, the New York image to the left, that's the image of just last week. And so we've had an opportunity to collaborate with the Orange County executive, the Orange County Commissioner of Health over the last several weeks. In fact, we just got off a session with them an hour ago. And so the New York image to the right demonstrates what we're up against and how we all should be taking this very seriously. What I'm going to do now is just go through a number of things that we are clear about today. And that is based on the guidance that we've been provided, social distancing to the extent we can will be at 3 feet apart. There's been a lot of questions. We've gotten phone calls. We all have gotten a ton of emails regarding whether or not we're going to mandate masks. And I'm going to take some time to break this down a little bit. As a district, we have not finalized that decision. However, based on the county call that we just got off of, what we know to be true is that the incoming governor will mandate masks, and that's already public. There's a news conference that was conducted today, and I'm sure if you haven't seen it already, it's already hitting the news waves that masks are going to be mandated. We do know that the CDC, the American Pediatrics Association, and the Orange County Department of Health are urging everyone, regardless of vaccination status, to wear masks. So I understand that there may be some of you who say, well, it's just a recommendation. And it is at this point, it is a recommendation, but it's a little stronger than a recommendation. It's an urging that everyone do this with the understanding that it is going to be mandated next week. So we dealt with a lot of quarantines last year, and I got to tell you personally, as well as my team, and as well as many of you, became very frustrated by your child riding the bus and every single person on the bus had to be quarantined, or everyone in the cafeteria had to be quarantined, even though your child may have not been near the person who was positive. So as I go through this, you'll understand how the guidance has now shifted in a way that I think is favorable to making sure that schools can safely open and safely stay open. All right. So we do know that children above the age of 12, as well as adults, have had access to vaccinations. And we're not saying you have to be vaccinated. We're just strongly encouraging it. And that's based off the science. We do know that children under 12 have not yet had the opportunity to be vaccinated. And even more important, why there's an urging of masks to be worn. And so as it relates to social distancing, as it's going to relate to quarantines, those who don't have masks on will be subjected to more frequent quarantines than other children who have their mask on. And that's really important. So I heard from a number of families who were upset that their children were quarantined and they didn't have daycare and they had to take off of work and their job was in jeopardy because they had to take off work a lot of times. Now, I can't tell you that's not going to happen at all. What I can tell you, based off our plans, based off the guidance, that should happen far less than it did last year. Now, transportation falls under federal guidelines and regulations. So what we know to be true today is that children who ride buses are required to have masks on. And as of right now, social distancing is not required. All right, so that is a big change from last year. As it relates to COVID testing, the Board of Ed has approved a resolution that will require all unvaccinated adults to be tested on a weekly basis. Right now, there's no resolution, no requirement to test children on a weekly basis, but there is speculation based on what's being discussed at the state as well as in Section 9 that there may be a requirement for children in high contact sports to engage in surveillance testing. Now, we did surveillance testing of 20% of our athletes last year. So again, just to be clear, all unvaccinated adults will be required to test on a weekly basis. Right now, that's only for adults until guidance and regulations change for students. We anticipate there may be a requirement for athletes. I want to just give you a minute to kind of take a look at this framework. And the point that I'd like to make here is that there's no silver bullet strategy to mitigate the spread of COVID or the Delta variant for that matter. It's a combination of strategies altogether. So hence why we've been stressing washing your hands, watching your distance, and wearing a mask. That's just a set of strategies. If someone is in isolation or quarantine, that's another mitigation strategy. And I'm going to quickly talk about the difference between isolation and quarantine in a second. Regularly washing down and wiping down high touched areas as we did last year, like doorknobs, stair railings. And then obviously one of the biggest mitigation strategies is to have the vaccination if you're 12 years or older. Now, as it relates to isolation and quarantines, there is a distinct difference between the two of them. Someone who is isolated is someone who is symptomatic. This is someone who is either perceived to be sick or is sick, and therefore they need to isolate themselves from other people for a period of time. And right now, that period of time is at least 10 days. Quarantine means you've come in contact with someone, and close contact right now is defined by anyone who is within 6 feet. So this is why we believe we're going to experience far less quarantines, because now we're only going to quarantine individuals who are within 6 feet, not the entire classroom, not the entire cafeteria, et cetera, et cetera. All right. So quarantine means you're not sick. You're not symptomatic. It means you were in close contact with someone who has tested positive. And I'm going to talk a little bit more about what happens to a child who does have to quarantine. I want to talk a little bit about a family action plan. Now, I could tell you, based on the many conversations that I personally have had, as well as people on my team have had, this has impacted families in ways that are extremely detrimental to stability in the home. But we're all required, and we all should take this very serious, that in the event schools are closed immediately, or in the event your child needs to isolate, in the event your child has to be quarantined, how are they receiving instruction? How are they receiving the care that they need? Hence going to the doctor and making sure they're being treated. I think it's very incumbent on each family. And we do have our FACE team here. Ms. Peterson is here, Dr. Roman is here, and they're working with a number of people to provide you with some strategies and some ideas on how to create a family plan. So that way, in the event your child, for instance, has to be quarantined, you have a plan in place to care for your child. So again, the family action plan, the kinds of questions you should be asking yourself, if my child is quarantined, they've been exposed to someone who's positive, or they need to be isolated, who's going to care for them? And the reason why I'm saying who is because we recognize that many parents have to work. It's really hard for them to be able to take off of work. And we even have heard from families who took off of work and lost their job. So again, we recognize the seriousness of this. So the learning model the district is offering is 5 days of in-person instruction. And so again, we heard many families loud and clear. You were very concerned last year when we didn't transition to 5 days of instruction. This year, that is the model that we're offering. And also, if I can just share quickly, is that we're receiving a lot of federal stimulus money in the millions. And that money is targeted to ensure that we're offering children in-person instruction. And so that is our goal. Our goal is to, again, safely reopen and stay open by offering children 5 days of in-person instruction. Now, we do understand that there are children who fall under the category of being medically fragile. And so I hope our medical director is on with us and may be able to answer questions, but I know Mr. Bear is on, our assistant superintendent of exceptional learners, and he could certainly talk to the work that we're doing right now to identify who may fall in this category. And so again, I just want to be very clear. The district is offering an in-person instructional model. We recognize that there may be children who cannot come in for instruction. Those particular children will be reviewed on a case-by-case basis, approved by our medical director to receive remote instruction. And for those children who fall in that category and receive an approval, they will receive remote instruction by one of our local BOCES. And so again, they'll be able to do remote at home, and they'll receive that remote instruction through BOCES. So for athletics, I know we've started to get a number of questions regarding athletics, and this is the information we have today. We anticipate that this is going to change over the next several weeks as our medical experts learn more and more about the new variant. But as of right now, we fall under Section 9. They're scheduled to mandate mask wearing next week, and that's only for indoor sports and will be required for all spectators. That as of what they have shared with us today, it's only for fall sports, fall indoor sports. Okay. So I'm going to share one last thing, and then I'll open up the floor for questions and comments. Okay. For a child who is quarantined. So I'll quickly just go back to that slide just because I don't want to forget this very important point. Okay, so I indicated earlier that I wanted to talk about quarantine and what happens to a child who has to quarantine. Again, quarantine means the child's not sick, the child is not symptomatic, and therefore, if we have to quarantine your child will receive live synchronous instruction, much similar to how they received it last year. So if you recall, last year, for those children who were not in on a Thursday, Friday, for instance, they received live synchronous instruction. Or anyone who was fully remote last year, they received live synchronous instruction. The expectation that we're going to have is that if your child is quarantined, they will receive live synchronous instruction by their teacher. They will need to log on at the time that class is being taught to receive credit for attendance and for the work. All right, so for many of you who may have that question, what happens to my child if he or she is quarantined? How are they going to be instructed? They're going to receive live synchronous instruction from their teacher. All right, so I'm going to stop sharing my screen, and then Dr. Sklarz and the team, you can assist me with answering some of the questions that are in the chat room. And then Dr. Sklarz, if you can, for those who have their hands up, you can go ahead and unmute them and allow them to ask the question.
Dr. Padilla, as soon as you call on somebody, I can unmute them.
Okay. I do know in the chat room, there's a question regarding if can a parent homeschool until they feel comfortable? I mean, it is every parent's right to be able to homeschool. We hope that you would feel comfortable to allow your child to come in with all of the mitigation strategies that we will have in place, similar to what we did last year. And I'll just quickly note, our team, our teachers, our faculty and staff did a really good job ensuring that our schools did not become super spreaders. And that's also true of all the neighboring districts that had all their kids in. Schools were not super spreaders because everyone was very diligent in enacting the multiple strategies all at once. So again, it is a parent's right to homeschool, and we respect that right. We would hope that you would give our model a chance before doing so. All right, I see Dr. Thomas has his hand up.
Yes, I first want to say I really love that presentation because it kind of brings all these multiple little fragmented moving pieces under one in one place, and that really makes things a little bit more clear. I just want to discuss a little bit about this terminology, medically fragile child, and it's a term that's new to me, and I think it's new to a lot of other physicians. When I looked at all the state definitions and services, every state varies what they consider to be a medically fragile child and what services that are provided. I think managing what's defined as medically fragile is going to depend upon what resources we have in the school and in the community. I don't think it's going to be a straightforward, clear shot. That, you know, we're going to have to take. It's going to have to be case by case and comparing to what we have, what resources we can refer, because we really don't have any guidance from the state on that issue. The other thing I want to say is I don't know what was mentioned about masks and vaccinations, but I think after a year, I think it's very clear that being vaccinated and wearing masks in the right environment is very effective and prevents disease and keeps you safe and prevents the spread. And that's the only thing I wanted to say.
All right, thank you, Dr. Thomas. And again, for those of you who might be joining us, Dr. Thomas is the medical director for the district. I imagine each district is consulting with their medical director, as you know, they're more of the experts in this area than we are. And this is why we have to lean on the medical field, the healthcare professionals to guide us. I know as I'm looking in the chat room, there are a number of questions regarding schedules and school assignments. And again, Ms. Peterson is here and she's taking note of that. This generally is the time of year we do get a lot of these questions because schedules are being finalized. So I would ask to just hold on tight. You will be finding out about which school your child is attending if you're new to the district, or your child is in one of those transitional grades, right? That information will be sent out within the next week. Let me just also note, as before we call on another person, that the idea behind the layered strategies is that, again, no one strategy by itself can work. It's when you put them all together, and no one strategy should hinder us from having in-person learning for all students. So the idea behind this is, to the extent possible, right, we maintain social distancing. And social distancing here is 3 feet when you count head to head. And when you do that, we should be able to get a full class in. Recognizing that in some cases, you know, we may go a little below that, right? So again, it's about various strategies all together, doing our very best, putting forward our best effort to enact all of these strategies, understanding that no one strategy should hinder us from having all students in person. I hope that helps with some of the questions regarding social distancing. It's the same challenge we experienced last year on transportation when we were concerned how we were going to transport all of our children when we had the social distance on the bus. So right now we know that's no longer a requirement. There's a question. So Heather asks, if there's a large group of children who become sick, will the school shut down? And we're certainly going to treat every case, every school on a case-by-case basis, just as we did last year. There were a couple times last year where we did have to shut the school down. Again, the guidance is different this year. So we anticipate far less closures, far less quarantines. Nevertheless, this is why I stress the point. This is why I'm really trying to stress the point between wearing masks, practicing a number of mitigation strategies, all right? So that way we encounter that far less than we did last year.
Dr. Padilla, can I make a couple comments if that's okay?
Please.
I'm Chris Bayer, the Assistant Superintendent for Exceptional Learners. There are a couple of questions with regard to testing and vaccinations. So one of the questions was, will we, our nurses, force students to be vaccinated against their will or against the wishes of the family? It's clear in the CDC guidelines that we are not in the position of mandating vaccinations for students at this point. If there's any guidance otherwise from the government, we'll certainly take their lead, but that is not the intention at this point. Also, we are not currently planning on testing students who are vaccinated unless that is provided some guidance from the government as well. Those are two important pieces I thought needed to be clarified.
Okay. And I'm trying my best to read and respond to many of the questions that are in the chat room. So I have a question regarding ventilation. So we will continue to use the highest grade filters that are allowed in schools, and that's MERV 13s. So we are prepared. We have them. They've been installed. So we have the best grade available for our equipment. So I hope that gives you some comfort. And we also have engaged in renovation work that is complete at this point as it relates to our HVAC system. And we are allocating an additional $6.9 million to continue doing ventilation work. So we're making huge investments in ventilation. We have the filters in place. And so for those who have questions around that, I hope that helps. For any child who, again, based on what Dr. Thomas and Mr. Baer were referring to for medically fragile, if a child is approved for that and they receive their instruction from BOCES, yes, they are still a student of the district. All right, so please let me make that very clear. They are still a student in the Newburgh School District. I see Ms. Charlene Gonzalez has her hand up.
Yeah, how are you?
Hi.
I just noted that when you was explaining what's going on, you were telling there was a lot of money for the federal government to provide for you guys to open the school, right?
Correct.
But why you don't take or make a plan for a little bit of that money put into a virtual choice for children that are not vaccinated? Because you know better than anybody, and in the position that you are, there is no safety without vaccines and masks. And our elementary children's gonna suffer. They're gonna pay the price. They are the one who are gonna be sick, like it's happening all around the country. All around the country, it's in the news, it's data. They are the one who getting affected, ICU, intubated, and some of them dying. Why we have to put our children to this? If you guys only invest a little bit of that money just in the virtual part, so the parent that they want to take the chance and send the children to school and go with your plan, fine. But also give the other parents an option, so they will have for their children. For an example, I have a 6-year-old that is he got a little bit autism, So he is gonna be problem with him to keep his mask on most of the time. You understand? So if he gets sick, he's gonna bring it to his sister. Then we all here are vaccinated, thank God. But they don't have the vaccine. If they wouldn't have the vaccine today, I would check them right now and vaccinate them so they can go safely to school. But I think it should be an option for the parents that they need that virtual part for the children. And I think don't give it to them or to us is wrong. It's wrong.
Thank you, Mr. Gonzalez. And we certainly, we hear you. And we recognize that this is tough. It really is. And I can hear it in your voice. I do want to share, children under 12 didn't have the vaccine last year either. And I want to share with you some interesting data that we were able to uncover. We actually had more kids test positive who were home remotely than children who were in person. And I was a little surprised by that because naturally I would have thought it would have been the other way around. But as I further thought about it, it kind of started to make sense to me. Well, why would children who are home test more positive than children who are in school? And the reason for that is children who are in school are practicing the strategies. They're wearing the mask, right? They're washing their hands more. They're going down hallways that are one lane. There were a number of things that we had in schools that made that possible, where children were testing positive far less. So again, we're going to continue to, again, I'm not indicating we have the perfect plan. We're certainly trying to do our very best. We are following the guidance of the state education department saying schools need to get kids back in person. And this is exactly what we're doing. I saw there's a question in there around transportation that I just want to quickly highlight. And the question was around how is it that transportation can mandate masks, but it's not yet mandated in schools? And that's an interesting question that I think we all had at one point. And the difference is the transportation falls under federal regulations. Federal regulations determine that children who ride the bus must wear masks. So that's something outside of our control because it's a federal regulation. We're all bound by it. And so that's why those masks have to be worn no matter what. And again, we anticipate that in New York State, masks are going to be mandated by next week. All right. I see Miss Morris, Michelle Morris has her hand up.
Hi.
Hi.
I would just like to say that on the last person that was on talking, the man, he is correct with a lot of things that we should have our own decision. I was frontline every day. I work in this pandemic. I work in a hospital. So I do know firsthand off how things are going, what's happening, and how it can affect these kids. My grandson also, who I raised, and he's 10 years old, has not had the vaccine. The mask, absolutely. Whoever is stating that these masks helped you from not getting COVID, no, it helps a little bit, but the only fact, the ones that do help is the N95s, and kids can't wear N95s in school all day. We should all have a say on how our kids can learn, because I don't feel safe for my grandson to go to school when this COVID and this Delta is out there. I work in it every day. I'm in ICU, the OR. That's my field. So I see it hands off first. People that are vaccinated that are still getting COVID in my profession, in my job. It depends on the immune system of the person, how that COVID and stuff affects that person. So for us to give it to a kid, we don't know really like if it's going to be passed along. And it also starts in the home. How do we know where those kids' parents are hanging out or who they're around? They can be passing it to their kids and bringing it to the school, vice versa, as if they're staying home being virtual and somebody in my household passes it along to my grandson. So it's both sides are very shaky. To me, I feel like I don't want my grandson in the public school. I'd rather for him to stay on virtual and learn that way. I have the resources for somebody to be here with him. I don't know about other families in their situations, but for me, I do not feel comfortable with it because I see it every day. I'm living in it. I've been in this pandemic from day one that is starting. And now that it's coming back up in my own job again, it's rising rapidly. And when I come home, I have to be cautious because I have to strip before I come into my house, put my things into a dust cover, because that COVID, as you should know, as the doctor should know, it lays on your uniform, your clothes for 17 hours. They don't even know if it can be in your hair. That's why we have to cover up. We have to put goggles on because they don't know really how this stuff gets into people. They don't know. So it's very scary.
I just want to thank you for sharing your, what you have, but also share you for being on the front lines. And so for everyone who's on here who worked on the front lines, we owe you a debt of gratitude. So thank you. And I don't want to speak as though I'm a medical expert in this because I'm not. And this is why we have our medical director. My understanding regarding the mask, again, is that it's one strategy for mitigating COVID. And my understanding of the mask also that it helps to not spread it, not necessarily not get it, right? And again, if we kind of take a look at the data that the information I shared about more children testing positive at home than in schools, it's because we had a number of things in place at the same time. All right, I see Miss Wendy LaFaro has her hand up.
Hello.
Yes, hi.
Hi, thank you for giving me the opportunity to talk. You said students that have medical conditions. What about parents I'm a severe asthmatic. I haven't been out during the pandemic shopping, as some people would say, and neither really have my kids. And they did very well virtually last year, all above 90. I got 5 kids in this house. We worked very well together. What options do we have? I mean, why isn't there some sort of virtual? Parents are immunocompromised too. I'm still working from home since March 2020.
Mr. Thomas, do you want to maybe, I don't know if I can respond to, parents who may have medical conditions. I know, again, it's something that we are going to review on a case-by-case basis.
I'm not sure I understand the question. If you could clarify for me.
It's okay. I mean, what Ms. LaFaro was highlighting was she's medically compromised. And so she was raising a concern about what this might mean for her and her family with children going back.
I mean, it might be a personal question, but if you're immunized, you should have a big reassurance, a big safety feeling if you've been vaccinated. If you've been vaccinated and you wear a mask in crowded places, that should give you some reassurance.
Okay.
I mean, I don't know your full medical story, but that's one thing I could recommend.
All right, I'm just going to take a look in the chat room and see if there's some questions that I might have missed.
Padilla, someone asked about sports for the fall.
Yeah, so again, right now, sports are a full go. We have not been given any information that they're not. I know that the state education department just came out with guidance last week, and the CDC the week before that. So we're just getting, some updated guidance as well. What we know as of today is that sports, at least for the fall, are scheduled as they traditionally have. That may change. We anticipate as of next week that Section 9 is going to require masks of athletes that have indoor sports. And again, as it relates to surveillance testing, we're not 100% sure about that just yet. So we're anticipating for some guidance to come out hopefully soon as it relates to any revised expectations that schools have to comply with.
Aaron also asked Dr. Padilla whether they should be holding on to their Chromebooks starting in the fall.
Yeah, we are prepared to give every single scholar a Chromebook. We are a one-to-one school district. And this is why I was trying to stress earlier the point that in the event a child has to quarantine, they should be able to receive live synchronous instruction, because we're going to provide them the tool in order to do that. All right, I see there's a question regarding quarantine time and isolation time for 10 days. And that is correct. That is our understanding based on the latest guidance. The CDC made that change, I believe, in the spring of last year. It's the same guidance that we have now, that quarantines and isolations will remain at that same 10-day period. And that does include weekends. There's a question about, will kids under 12 be tested and how often? Right now, there's not a requirement to test children. We will be prepared in the event that we have to test children. And I could tell you a little bit of the conversation that we've been having with the county. The county has received $10.5 million to support schools in Orange County with testing. And so we're waiting to get some guidance for them on either they're going to provide us the test or they're going to reimburse us for the test.
Additionally, Dr. Padilla, I think it's good to talk about the fact of what we're doing with regard to vaccination drives. We are sponsoring one this Monday, but you want to go into detail about that?
Yeah, please go ahead.
So Dr. Roman's on the phone as well, or on the call. He's been working this past year with developing vaccination drives and did some in the spring. We are partnering with Middletown Medical. Our first vaccination drive will be this Monday, I believe, Dr. Roman, it's 9 to 12, and it will be at NFA Maine and is open to the public. So we really encourage anyone who would like to come, as well as any students over 12, where parents want their children to be vaccinated, to come to NFA Maine that day. We will be sponsoring a vaccination drive weekly over the next 4 weeks, and we'll be announcing those dates as well.
So just to reiterate, we're going to be holding, as we did this summer and in the spring, vaccination drives to encourage and support anyone who would like to be vaccinated. Again, that is one of the mitigation strategies. And so we're going to do them several times starting next Monday. I'm trying my best to get the people who have their hand up. We have over 600 people joining us. And so again, I'm just really appreciative that you're taking some time out. I know this is extremely important, and that's why you're with us. Okay, I know there's a number of questions in here and comments regarding a virtual option. And I recognize, along with masking, that those are the two sort of hot topics, not just for Newburgh, it's the case for the entire county. My understanding is no district in the county is offering a remote model, but nevertheless, as I indicated earlier, our focus has been on safely reopening schools and getting kids in 5 days a week. We have upgraded our ventilation system. We have put in the filters. Our facilities are being prepared so that students can return on September 1st. I recognize that there are families who are going to want to homeschool. I also recognize that there are children who are medically fragile, who absolutely need to have access to instruction. And so that's why we facilitated a partnership in order for that to work. And again, children who are quarantined, again, albeit far less than what we had last year, we're prepared to offer them live synchronous instruction for the days that they have to be home. I'll also note, just in case it's asked, we have the equipment in our schools to fog. We'll do the same thing we did with our cleaners last year, where they'll be throughout the day wiping down areas that are frequently touched. Classrooms will be cleaned on a daily basis. And if you ask your children, they probably recognized in the spring when they started to come into the school that there was a sticker on the door that had to be cracked in order to get in. And that was a visual indication that the room was clean. All right, I see Miss Michelle Ryder has her hand up.
Hi.
Hi.
Dr. Padilla. First, thank you for doing everything that you're all doing to try to get the kids back in school. I think, we opted to stay home full time until now with my high schooler, and, we believe the science. So we're hopeful that with the right protections, we keep, outbreak rates really low. But I think academically and from a mental health standpoint, it's really important for some of these kids to get back into school. With that being said, our community positivity rate and our vaccination rate is not looking that great right now. In this community, where I think we're still, the last I looked at, just about 50% vaccination, which is not yet close to what would be considered herd immunity. So is the district thinking about what happens if the positivity rate starts to climb? Are we getting any direction from the state in terms of, what that rate needs to be before you would have to pivot and have another closure? Is that the district's decision, or does the state give you any guidelines on that?
Thank you. Thank you, Michelle. So it's kind of twofold. So one, the guidance has been be prepared to pivot. So what we're going to be telling our teachers and what we told our administrators today is that teachers have to set up Google Classrooms. So that way, in the event we do have to pivot, they can resume the work that's done on Google Classroom virtually. And our teachers have done a phenomenal job. Our teachers, in addition to the healthcare professionals, were on the front line, and they pivoted very successfully. And we have confidence they'll be able to do that again. As it relates to, so there's a decision that the state government can make that says all schools need to close. And they did that last year. Right before the state government closed schools, the county had closed, the county executive also has the authority to close schools in the county, which he did 2 days prior to the state government doing that. Then there's the third sort of leg of this, and that is we can close schools if we feel, there's a breakout. Now, last year, we didn't have to close the schools a lot. In fact, we closed the schools far less than the other districts in the county. So, we're going to closely monitor this. We had to close schools last year several times because everyone needed to quarantine. And when you're quarantining 200 people and 20 teachers, it's hard to staff the building at that point. Again, based on the guidance we have now, the only individuals who will be quarantined are those who are in close contact who aren't wearing a mask. So if children are wearing a mask, they don't have to quarantine. If an adult is vaccinated, they won't have to quarantine. So we have a little more stability than we've had in previous years, or in at least the previous year and a half.
Does that also apply to children who are vaccinated?
It would. If you're 12 years and older and you're vaccinated and you're wearing your mask, you won't need to quarantine.
Thank you.
Okay. Again, just to be very transparent, because we've gotten the calls and we've gotten the emails. We recognize, and this is the reason why we wanted to have this town hall. As you know, we were going to have it last night and we pushed it back till today because we had a very important county meeting that was scheduled where we were anticipating some critical information. So we recognize your concern. We recognize that you have frustration, and I would say they're rightly put. I mean, we're talking about serious matters, and I want you to know that we are absolutely taking this serious as well. When we were remote last year, we had parents knocking our door down saying we need to get back to 5 days of in-person instruction. New York State Department of Education has said we need to get back to 5 days of in-person instruction. The federal government has provided school districts with millions of dollars to get children back to in-person instruction. And I understand that might be unsettling, and it is. But that's our model right now. All right, I'm gonna check in the,
One of the questions is whether or not vaccinated students will have to be quarantined if they are in close proximity during the school day. I believe the answer would be they would not be, just like any other vaccinated person. They would not require to be quarantined, but they have to monitor their symptoms for 3 to 5 days, just like the adults. And CDC recommends that, not mandates, that anyone who is exposed, even if they're vaccinated, receive a COVID test to be sure within those 5 day period. But I want to make sure I have that correct, Dr. Padilla.
yeah, thank you. I know I just saw a question in there about masks. Again, I can tell you that it's our belief based on information released today that masks will be mandated probably next week. I can also tell you that Orange County school districts will be mandating masks by the end of the week. And so we do intend to do the same thing.
Hi, Dr. Padilla. Sharon, can I just mention something?
Please, Sharon. Can you just
Okay.
introduce yourself and so everyone knows?
Yes, hi, I'm Sharon Patsalos. I'm the health service facilitator for the Newburgh District. I just wanted to reiterate, like everything in life, it's an ongoing risk assessment. So we're constantly looking at everything that's coming in and making an assessment and, collaborating with the Orange County Department of Health, New York State Department of Health, CDC guidelines, and trying to make the best decisions to keep our students, faculty, and staff safe. Last year, we utilized all the district mitigation strategies, contact tracing, quarantine, isolation, and we did everything in collaboration with our local health department. And we had minimal cross-infection or spread within the school. So most of the cases that we saw were community-based and, we followed them, but there was not a lot of cross-contamination like with the students in the classroom or teachers. So, I believe our mitigation strategies and our layered strategies that we use really helped us out last year. So I also think that going back in person in school, according to the CDC, didn't seem to be a major risk factor for children if they maintained the prevention measures, which we're using, wearing masks, physical distancing. Most of the things that we saw were the outside community things that were happening, like the attending parties, going to funerals, weddings, which are all part of life. But this is part of our ongoing risk assessment. So we also did testing within the schools last year, faculty, staff, students, and again, it showed minimal positivity rate while we did our testing. So I think a lot of the strategies we're using within the district right now and which we can build upon, and if anybody has suggestions or thoughts of other things we should be doing, we will definitely take that into consideration. But I think if we provide the vaccination clinics, enforce our layered mitigation strategies, ongoing assessment, that's going to help reduce the transmission of the variant. So, we're here for you and we will listen to anything. You can call me. I'm available, and anything that you feel that we should be doing differently, I will take that into consideration.
All right, I want to highlight one of the points that Sharon, you made, and that is the CDC and the American Pediatrics Association have advised that students be in school. So again, you have two of the biggest agencies, and they're saying children need to be back in school. So it's not that we're making this decision to have children be back in school in a vacuum. We're not. We're actually following what the medical experts are saying. And they're saying children need to be back in school. All right, I know we're coming close to the end, and I'm trying to catch up with some of the things that are in the chat room, and also want to just extend outside of just tonight's town hall. There are opportunities for us to talk on the phone. Please, you can call my office. You can email. Again, my team is prepared to answer questions. We are going to be putting out a reopening guidebook where a lot of this information and more will be listed in writing for you. We anticipate that will be out on Friday. So we ask that you just kind of look out for that. All right. So we'll have 2 families, 2 faculty and staff, what we're calling the reopening guidebook that has expectations. It will have information regarding the mitigation strategies for you to review. And then again, just want to remind you that the first day for students this year is September 1st, not after Labor Day. So if you can just make a mental reminder of that. And again, I'm gonna put my office number in the chat. If you would like to follow up, by all means, we can schedule some time so that way we can try our very best to answer as many questions as possible, recognizing that I know it might not make everyone fully comfortable, but we did think it was important tonight to have this session, to hear some of your questions, and also to share where we're at as a district. All right.
Dr. Padilla, I just want to clarify, I keep Lisa Marie Spindler, Assistant Superintendent of Finance, and I do see some chat stating that the impression is that if we have kids go to school, we get more funding, and that's not true. So the stimulus money has already been allotted to the school district. The suggestion on the allowances and how we should utilize the money from the federal government was to reopen schools and to get as many kids in person. So it's not because we're not requesting this 5 days in person in order to get it. The money has already been allotted. So I just want to clarify that from the chat.
Okay. All right. Thank you, everyone. Have a great evening. And please be on the lookout for the guidance, the reopening guidebook on Friday.